Are we there? Can you hear me now? Oh, no.
There we can, Angela, we can hear you.
Yes, okay, you can.
Hear you.
Okay, thank you.
All good.
Okay, sorry about that. Technology is not my strong point. I'm much better at nursing, which is good. So I work at the New Victoria with all of the different breast cancer doctors here, and my role starts at diagnosis. I was asked to talk to you about my role in your care, and it's actually much harder to talk about yourself when you've been doing something for years and years. It becomes part of you. I am CNS, it's what I do, and after 27 years of cancer nursing, it's just an extension of me. So to plan for this talk, I started by asking patients here and admin and other health providers what they thought my job entails, so that I could build something a bit more meaningful to discuss with you this evening. So this is what the people here very cleverly came up with, that I support patients on their journey from diagnosis to discharge. But most people that I spoke to thought that the C in CNS was for cancer, when in fact it's clinical. We CNSs are everywhere, from midwifery to orthopedics, not just specific to oncology. We are nurses who have, there I am in the olden days collecting my masters, who have completed nurse training and then a specialised study, as Prof. Zoe told you, I did gynae and breast in one particular area, then 5 years on the job before you can apply for a CNS position. NHS England said that it was very difficult to quantify our roles, as we're each bespoke to specific pathways, and that's the beauty of the support I can offer to patients. Our interactions will always be entirely personalised to you and your definitions of your needs in your own situation. My role in your care is privileged. We meet on one of the worst days of your life, and I'm still by your side and one of the best when you are discharged. A CNS supports you through your entire journey. The bombshell of cancer is something that we all fear. There isn't one of us talking or listening this evening who hasn't been touched by cancer. Fear of the unknown is the most difficult fear to overcome, and often patients tell me that they are completely overwhelmed by the diagnosis, investigations, and the treatment decisions they make when they are initially diagnosed. I liken those early days of diagnosis to being in a situation where you're having to learn a whole new medical language whilst making life-changing decisions about something you don't ever even want to think about. And as your CNS, I'll be right next to you at all your consultations, helping you remember the questions that you and I have discussed on the phone, that you wanted to ask your doctor, that you forgot to ask. I have time for you and your family to explain over and over what the doctors have told you. I anticipate and I organise the things that you don't even know that you need yet. And during this time, you and I form a tight, trusting relationship that works both ways and ensures that we have open communication. One of the most important roles of a CNS is education, and I'll give you bespoke information from credible sources based on your exact needs, not the Dr. Google when you go off and look for things. This will empower you to confidently be prepared to make decisions about your treatment. If I had £1 for every time a patient says to me, "This is a strange question, but more often I've looked after another lady who's experienced the same, so I can draw on my experience to help you." And of course, if I don't know the answer, due to this close working relationship I told you about with the consultants, I can always send them a message. Just a little bit about the breast cancer pathway. I think it's safe to say that across most cancer tumour groups, that when patients are first diagnosed with cancer, the immediate thought goes to surgery. However, as the pathway diagram shows, at the bottom there, in red, there are some types of breast cancer that we know respond far favourably to upfront chemotherapy, followed by surgery. And at the New Victoria, we have a really special umbrella partnership with oncology providers. We are able to offer our patients that need systemic treatments a collaborative medical care. And as your CNS, if you do have chemo or other medical treatments, I'll continue to support you. We'll navigate the pathway together and return for surgery. So what happens moving forward? This is a fearful time for patients when medical treatments are winding down and your follow-ups are a little less frequent. But the care never stops. Patients can stop us and contact CNS at any time, never having to wait between appointments. We're available by phone or email, and we support holistically with all aspects of health. diet, sleeping, stress levels, psychological impact. It's really rewarding for me to see the advice I give make difference to patients and their conditions, and to see women happily returning to see us in the New Vic for clinic appointments. There are, according to Cancer Research UK, 55,000 cases of new breast cancer in the UK. And like most cancers, if you catch breast cancer early, it's completely curable. So my advice to you from a friend, a mum, a sister, is to take action for yourself, to visit your breast doctor. And if the unimaginable does happen, we'll be right here to support you on your journey. Thank you.